ACN Studios. This is The Morning Show.
An estimated 16 million people in the United States have it. Many more go undiagnosed. We're talking about rosacea, and Dr. Ruth Tedaldi is here to help. This is almost as bad as acne, isn't it?
Well, it's one of those conditions where you become very self-conscious. That redness, that florid flush can come at any time. Some people have predictable moments, but many don't.
Yeah, it's not just flushed cheeks. It's really red, and there's a treatment that you're teaching us about today.
Well, there are lots of treatments, and I definitely recommend that you see your dermatologist because I usually, as do most dermatologists, put you on a treatment plan with topical regimen as well. But there are lasers that are quite effective, and so I think it's really important to realize all that's available out there.
So we're going to see how you use one of those lasers on a patient who didn't want to be identified, but we still got to see the process.
So after your last laser treatment, how did you feel?
So the first few days, it was still very sensitive and very red and actually a little bit swollen. But then after a week is when I started seeing a really, really big difference.
You came in to see me and your cheeks were very, very florid red, and it was something that you had carried with you for most of your adult life. And we started slowly because I don't like to do anything aggressively, right? That's just my nature. After the first treatment, did you feel like things were starting to improve?
I did. You know, it was usually at certain times of the year, my face was so inflamed it looked like I had a very bad sunburn.
So lasers are a great alternative, but you were afraid of lasers in the beginning, correct?
I was, and for me it wasn't just a little bit of redness like you would put a little bit of blush on. It was really, really inflamed, and I couldn't go out even to do errands without some sort of a concealer on. And it was actually getting worse, and even the texture of my skin, I used to get these bumps, so that happened for the last couple of years after I had rosacea for years. So even the texture of my skin was getting worse and worse.
But what's nice about the laser is you have no scarring. You have no real telltale signs that you even had laser. You did have some redness and some swelling after the treatment, correct?
For a couple of days, but that went down very, very quickly.
And you were very careful in the sun.
I don't stay in the sun anymore.
Because you're my patient,
right?
Right. I like to hear that. Makes my day. So yet again, one more thing that I think just gives you a better feeling about yourself. Would you say that's true?
Most definitely. And now I can even go out of the house without any makeup on. I can just put a little bit of mascara, lip gloss, and I can go out.
Yes, it is every woman's dream to just be able to go out of the house and not have to pile on the makeup. That was the Vbeam laser?
It's called a Vbeam. It's a pulse dye laser. So it targets either hemoglobin, which is one pigment, or melanin, which is another pigment, and we can treat different conditions that have either too much redness or too much brown discoloration. It's a little uncomfortable, but not terribly, and it really does work.
So is it the only laser to treat rosacea, or are there other options?
There are many, many lasers, and there are many different, even vascular lasers. But this laser tends to be, I think, one of my mainstays in terms of how successful it is, and I can almost promise a patient that 1 or 2 treatments, they're going to feel quite different.
What about people who think maybe, they're not washing their face enough and that's why they have rosacea, or they're eating the wrong things and that's why they have rosacea?
Well, there's no question that certain dietary conditions will absolutely make your rosacea worse, and we will give you a list of foods that could be provocative, but not necessarily, so it's hit or miss as well. And I also think that just hygiene and the way you care for your skin is important.
Will rosacea go away forever once you get a laser treatment like that?
No, I don't think, we don't use forever a lot. I don't ever use forever anymore. But I think that it helps a lot, and sometimes people are lucky and their rosacea will be controlled on a long-term basis. So it's just one of those treatments that I really like because it works.
Thank you so much, Dr. Tedaldi. And as always, if you have any questions for our good doctor here, you can send them to tedalditreatment@necn.com.